A warm welcome to Health and Lifestyle. As always, we're glad that you could make the time for us. My name is Maria. Our social media handles at KBC Channel 1 on X is where you can interact with us. Now, the COVID-19 pandemic was a wake-up call, not just for Kenya, but for the entire world. It showed us just how critical strong health systems, disease surveillance, and timely data sharing are in protecting lives. Now, in response, the East African community has recently launched a new policy framework aimed at strengthening regional coordination during disease outbreaks. That's our focus today: pandemics and health security. But first, here's a look at what's coming up. EAC rolls out new pandemic preparedness guidelines. Kenya National Public Health Institute leads health security efforts. And on good practice, healthy habits for a safer community. And to a first segment. After facing deadly outbreaks like COVID-19, Ebola, Marburg, and Mpox, which really exposed gaps in regional health systems, the East African community has now rolled out new guidelines to help the region prepare better and respond faster to future pandemics. I spoke to the EAC Deputy Secretary General, Andrea Akir.
We are here today to roll out a policy, a framework that has been developed by the community. Given the challenges of the pandemic that have been striking our community, be it Marburg, be it COVID, be it Ebola, cholera, among others, and that are always eminent, and they have claimed lives of so many of our people in the community. The community sat down and developed a policy, a framework that should actually govern the pandemic preparedness and response mechanism. And the policy was developed through partner states. We did consultations with partner states, and then we did a regional validation, and thereafter it was presented to the Health Sector Council that approves it.
The idea, he says, is to strengthen health systems and improve how countries work together, especially at a time when donor funding is shrinking.
The policy is to strengthen our governance systems, the health systems, and the policy is advocating for more financing at health sector. We have known that partner states give each partner state has a different priority, and we have realized that we have a serious financial gap in health sector as a community, and this policy will advocate for more financing in health sector. You know, you cannot fight security, you cannot develop roads if you are not healthy, and we take our health as number one, and this policy will advocate for one, financing, two, seamless coordination within partner states, and three, pulling together the experts so that once we have a problem, then we respond as a community because we have already a team of experts prepared to fight for any pandemic disease. So basically, that is what we intend to achieve as a community using that policy.
He pointed out just how difficult it was for African countries to access vaccines during COVID-19. And to avoid that happening again, the EAC is now using a regional center in Kigali, Rwanda, to push for joint negotiations on vaccines and medicines.
We have a center in Kigali, and that center is actually, we work together as a community to advance on how to manufacture vaccine, and not only vaccines. We are looking as a community because as much as we look outside on modern vaccines, we also have vaccines as East African that need to be promoted to fight diseases. Our people before the modernity used to treat diseases, and we have all those local medicines that only need to be improved, add value, and we use them. And that policy, the center does not only advocate for vaccine manufacturing, it also put the community together, as I said, that if we even go to source medicine outside there, we don't go as individual countries. You don't go there and negotiate as 12 million people. You don't go there and negotiate as 8 million people. You will be compromised you will be taken advantage because of the population you have. But if you go outside there and meet the companies that manufacture vaccines, it is either you work with the community of 350 million or you lose that market.
The meeting brought together EAC member states, and Uganda's Edward Sebina stressed that the region also needs a multi-sectoral approach that is bringing together health, environmental and animal sectors under what is known as the One Health framework.
Pandemic preparedness is not a government, it should be a multi-sectoral approach with dealing with this. Pandemic preparedness has been a big challenge. We need to strengthen or establish coordination offices, which coordination offices are able to run away with the One Health approach, both for human, environmental issues and animal issues. As a region, we have trained a pool of deployable experts to handle pandemics in the region. This pool is made of all experts from all the countries, Tanzania, Kenya, Uganda, and the others. So this pool can rapidly be deployed to deal with the threats. East Africans will move anyway, whether at the official points of entry or unofficial. So this is another big challenge, but I think this calls for a lot of sensitization, mass sensitization of the communities, of the local communities, to know the impact if they cross borders and without being screened, and because we are at the points of entry, there's been a lot of good work at point of entry for screening.
You know, outbreaks like COVID-19, Ebola, Mpox have shown us just how important it is to take care of our health. So today we are sharing some simple practical steps you can take to stay safe and healthy on Good Practice. You know, while outbreaks like COVID-19, Ebola, and Mpox can feel overwhelming, there are simple things we can all do to stay safe. First, wash your hands regularly. It sounds basic, but clean hands are a first line of defense against infections. Next, practice good respiratory hygiene. Cover your mouth when you cough or sneeze and wear a mask if you're in crowded spaces or during an outbreak. Also stay informed. Follow updates from trusted sources like the Kenya National Public Health Institute or the East African Community. Knowing what's happening helps us make smart choices. And don't forget vaccines. They are one of the best ways to protect yourself and your loved ones from serious diseases. And finally, remember that healthy habits matter. Eating well, getting enough sleep, and exercising regularly can boost your immunity and help your body fight infections. By taking these small steps, we all play a part in keeping ourselves and our communities safe. And by taking these small steps, we all play a part in keeping ourselves and our communities safe. And on that note, we take our first break of the program. I'll be back with much more. Welcome back to the program, and we continue where the region, of course, is still facing threats from emerging and re-emerging diseases like Ebola, Mpox, and other viral outbreaks, showing just how important strong cross-border coordination really is. Here in Kenya, the Kenya National Public Health Institute was set up to safeguard the country's health security. I spoke to Dr. Kamene Kimenye, the Acting Director General, who started by explaining what the Institute does and what health security actually means.
Our institute is mandated with generally health security. We carry out disease surveillance. We also do the preparedness, the prevention bit. We do a response, and depending on the situation, we also deal with the restoration. We are also mandated to deal with public health research. We deal with disease detection, so the component of the laboratory is also very key to us. Biosafety, biosecurity. all those in relation to diseases and our laboratories.
Now, the new regional pandemic preparedness framework strengthens regional health security by promoting shared preparedness and collective responses.
And recently we also had terminologies like diseases have no borders. It means that one disease in one country can wake up the next day and you find the disease in the next country. And so we have to be able to monitor our borders and control diseases that are moving across the borders. So this framework basically is aimed at looking at how can we, at a regional level, ensure that we are prepared in case of any disease like that might turn out to be a pandemic.
And now, not all outbreaks are the same. Some, like cholera, can be handled at the local or county level, but others, like Ebola, are much more serious, and they need coordination not just nationally, but across the region and even internationally.
If today you heard there is cholera in Kenya or you heard there's an Ebola in Kenya, how would you respond to the two as a person? So one of them is more likely to create panic than the other. The resources required will also be different. So at a local level, we will respond maybe at a county level, and we'll call upon the national level where the Kenya National Public Health comes in to support the counties in responding to such diseases, like if you are told there's an outbreak of cholera somewhere. However, if we hear that there's Ebola in another country and it might come into our country, that becomes of international public health interest. And as such, it is important that that country informs WHO. Usually the WHO is one that is informed, and then WHO communicates to us as countries that this disease has been notified in a nearby country. Then, as a country, then we look at our preparedness status and identify support funding to start looking at what are the loopholes. Do we have adequate testing capacities? Do we have adequate health workers to respond? Are the health workers trained? Is our community well informed? So we now develop also messages to inform them. So we will procure the commodities. We will have them distributed and kept in readiness. We say pre-positioning, in readiness to be deployed. In case of anything, we train the health workers and then we train the health communities in preparation for a response.
One of the biggest challenges in the health sector is funding. Many programs for infectious diseases like HIV and TB have relied heavily on donor support. So the big question is, what is Kenya doing about it?
As a country, we are moving towards domestic funding. We have started lobbying with our members of parliament for increased funding. And I must congratulate our country first for establishing the institute, the Kenya National Public Health Institute. It comes to solve one problem first: coordination. Previously, just like you can see at the regional level, we have a problem with coordination. We had a problem locally with coordination with different people and different institutions, all looking at pandemic preparedness and looking at how to respond.
And the question still is, are we fully prepared to face the next outbreak?
So we have a lot of systems we are going to put in place. There is hope for all of us. I see, in case disease X happens in another 4 years, I pray it doesn't happen yet, maybe in another 4 years, Kenya will be in a better place than it was when COVID happened. And with better systems, more informed people by that time. And of course, the Kenyan government is very committed to health security. We have very committed leadership in the ministry, and we are very grateful that this framework especially has been launched at this time, because we are sure that within those 4 or 5 years, most of these systems will be standing.
Of course, no country can tackle these challenges alone. Partnerships are key. And in these multi-sectoral efforts, organizations like the African Population and Health Research Center play a vital role. I spoke to Kotut Johnson. He is the Policy Administration Manager there, and to find out what his role has been in this project.
Okay, basically this project is about the health security of the region, preparing the region to be able to combat any form of pandemics or an health emergency in future. This project came as a result of the experiences that we went through during COVID-19 and the realization that there was a lack of coordination among the partner states in terms of facing this particular pandemic. So EAC felt that there was need for us to develop a policy framework that would be able to standardize how countries within the partner states respond to pandemic. And through the support from the Gates Foundation, APHRC and EAC came together and they were able to put up a project that now informed the development of this policy framework. Was on the aspect of surveillance in terms of tracking the way diseases occur within the region. And that now formed the priority area the first priority area in the policy framework. The second one is on the issues of research and development, which also formed some of the gaps that were realized. So basically this framework is a response to the gaps or the challenges that were faced by the region during the COVID-19 pandemic era.
COVID-19 showed us that even the facilities we thought were well equipped, hospitals and emergency departments included, could be quickly overwhelmed. It really highlighted just how urgent it is to build health systems that are resilient enough to handle both everyday health needs and major emergencies.
You see now when we don't have any pandemic, you can see that most of the things are in the normal spaces, that even the health systems can be able to accommodate some of the few disease incidences that we are having. But in case of a pandemic, it can be able to overwhelm all the health systems that we have, which now threatens the security of the health systems. So basically what happens is now that we have to ensure that we address the root cause of pandemic, or we become better prepared so that in case of a pandemic or an health emergency, we don't end losing the entire health system, including even the health force. You remember what happened during COVID, that even the infrastructure that we thought that we were having a well-established infrastructure, the health centers, the dispensaries, the wards that we have, all those, even the emergency departments in the hospital, we realized at that time that we were not secure because all those facilities that we thought we had were overwhelmed. So basically, being an health secure nation is ensuring that we have the capacity to be able to address the health needs of our people, irrespective of our situation, whether there is an health emergency or whether there is no health emergency at that particular time.
He says that while COVID-19 exposed weaknesses in our health systems, it also had a positive side. It boosted public awareness and improved health behaviors.
Through this project, we have been able to have what we call the data governance framework, which is a commitment from the partner states within the EAC to be sharing data freely. Because one of the critical aspects in response is when you have adequate data for you to be able to make a decision. So that if there is any pandemic or if there is an health emergency in Uganda, they can be able to share data with Kenya so that we become better prepared. I think you have seen even on the recent emergence like the monkeypox, you could hear that there are cases in Uganda, and within a week or so you hear there is a case in Kenya, and then you hear there is a case in Rwanda, Tanzania. If there is a better system of sharing data so that you can know exactly how to prepare yourself, then we can be able to maybe counter some of these challenges by effectively sharing data. And this policy framework provides for that the partner states would be able to freely share data. Absence of sharing data is a very costly exercise in health security, because you see, if we are able to get information early, or if the partner states would be able to share data early in advance, then the other country would be better prepared to respond or address a certain situation. Let's just take example of what happened during COVID and the data sharing in terms of those who are on the transport corridor. That if you travel from Uganda, you are tested for COVID and your data is with the system of Uganda. They know that they have tested you and this is the results of your test. And then you come to Kenya, you cross the border, the Kenyan authorities would also want to test so that they can also confirm the test that was done in Uganda. You know, it was a costly exercise because you have to repeat the whole process. But if there was a way that this data could be able to be shared, then the Kenyan authorities would be able to rely on the test that was done in Uganda. And also, if there was also a way that the Kenyan authority could also be able to share to Tanzania, like now the number of cases and the travel the trends of the people to Tanzania, they would also be able to be better prepared.
So while While the region continues to face the threat of emerging diseases, it's clear that stronger health systems, cross-border coordination, and local partnerships are more important than ever, from improving public awareness to building resilient hospitals and ensuring access to vaccines. The steps being taken now will help us respond better to the next outbreak and even maybe prevent one. Well, that's from us today on pandemics and health security. Stay safe, stay informed, and remember, good health is everyone's responsibility. On behalf of everyone, thank you for tuning in. See you next time.